Hi, this is Dr. Bill Lovett from your Wellness Center. This is part 3 of a 3-part series talking about IV therapy. Part 1 where I talked about what it is and how does it work, touched on the process a little bit. Part 2, which was a lot of information, talked about each individual option and how we can tailor make that to you as an individual. Part 3, I'm going to talk about, so how do we get started? How do we get started? We usually ask you to first go onto our webpage, yourwellnesscenter.com. In the resource tab, there is at the very top, there's an initial consultation click button you just hit, and you fill out that form and basically put, you're interested in IV therapy. If you know maybe exactly what you may be interested in, that information is helpful. That can be added into the form. But again, most of our IV therapy information is on our internet webpage, so you can actually review it for yourself before you even come in. That way, when you come in, you have questions. We can talk, and really answer in-depth questions for you. So we're going to talk, once you hit the button there, we will usually call you back, usually within 24 to 48 hours, and we will set up an appointment with you. I will tell you that usually the first appointment, we want to do a consult, and if you want to continue, we also will do a blood test. Now that blood test is very specific, looking at a lot of the electrolytes you have within your body, your sodium, your potassium, your calciums, all those kind of things. It's really what we're focused on. But more importantly, another enzyme called a G6PD. And what happens is when we use vitamin C, we can use so much, and then at that point, we have to make sure it's safe to give you more. And most patients, believe me, far majority of patients can get more vitamin C than we even have in our cocktails, but our cocktails are very safe. That G6PD is an enzyme that helps metabolize vitamin C, and we want to make sure you're not deficient in it. So that's the reason we check that one number. So when you come in here, you'll sit down with either myself or my nurse practitioner, Judy, and we'll sit down and say, okay, what are the symptoms you're having that you think an IV therapy cocktail would work for you? Some of these, you may be an athlete, young athlete, and you pretty much know that you want a specific cocktail because you want to boost your performance in recovery time. You may be a cancer patient. We know exactly that you're coming to us because you want high-dose vitamin C therapy. But again, there's other things that we may be able to add into it, some of the B vitamins and some of the other amino acid type complexes to help support you. So we'll talk about that in consult. We'll make sure that everything that we're going to do for you is perfect. We will then have you draw your blood. We'll discuss any contraindications, and to be honest with you, the only contraindication would be if you have a G6PD deficiency on that blood test. We wouldn't be able to give you high doses of vitamin C. We could still give you some vitamin C, but not high doses. It's about the only contraindication. There really isn't contraindications that giving you something your body already makes or needs or uses, except for the fact we're actually putting those numbers in levels much higher in your body. So this is what we do, this is what we discussed, and basically we go in and schedule you for your first IV therapy right there. Many of the IV therapies should occur weekly in the beginning, up for about 4 to 8 weeks, and then we kind of go bi-weekly after that, and then we kind of tailor it based on you and your needs. But we want to basically support your immune system quite a bit, especially if you're getting the immunity type therapies. It's not uncommon that we have patients that really will come in weekly during the kind of a late fall through early spring to really support that time where they feel that they get illness most commonly, and then we'll back down to that every 2 to 4 weeks during the rest of the year. So these are the kinds of things we do. We tailor make them to you, and it's we feel it's really important. This is the end of part 3. I'd encourage you to go back and start with part 1 and spend some time with part 2, which was quite complex, talked about specific IV therapies. But if you have any questions, please call us at 513-791-9474 and also get on our website on yourwellnesscenter.com. This is Dr. Bill Lovett. Thank you so much.